I've been bringing my daughter Taylor to the Tufts Dental Facility for around 8 years now.
It's welcoming. Everyone is always kind, nice, and takes great care of my brother.
When I recommend this clinic to my friends, I say it's like coming home. They are so friendly and so nice, and they're willing to work with you. They don't have to lay in the chair if they're scared. They don't have to use the sucky straw if that scares them. And the dentists and the staff are willing to work with that to make you and your child as comfortable as possible.
It's almost like putting together a jigsaw puzzle when I'm trying to treatment plan a patient. Looking at their behaviors, looking at their anxiety level, how fearful they are, what the condition of their mouth is.
I've had several patients over the years where at their first appointment, they didn't want to leave the waiting room. And I got them to the point where they'll come in, sit in the dental chair, allow a cleaning, even allow x-rays. But because we took so many baby steps and we worked with them until they could feel comfortable enough to allow treatment.
Sometimes all they did was count her teeth, 1 to 5, and the visit was over. But now she is able to have her teeth brushed, polished, flossed. She is able to receive a fluoride treatment.
Our focus is on the person. This is a person in our dental chair, in our operatory. Maybe they're standing up, maybe they're sitting in a stationary chair. They're here for treatment, and to focus on the person, I think brings a lot of value, not to just their experience, but the people that care for them.
They've let Adam be Adam, and they've taken care of him with all his little quirks and made him feel comfortable so he's not frightened to go to the dentist.
Here, he gets everything he needs as far as the specialized care goes, and people that understand him and understand the situation. So that to me is the most important part.
One of the really great things about these clinics is that we serve an educational purpose for all of the fourth-year dental students at Tufts. We're teaching them that special care dentistry is not a specialty. This is something that every general dentist has the ability to provide in their future offices, as long as they're willing to be patient, meet the patient where they're at, and think outside the box a little bit.
And just because our patients might have disabilities doesn't mean that the clinic shouldn't be state-of-the-art with digital scanners and video monitors and sensory accommodations. Anything that is possible in dentistry should be available to this patient population. And I see that being a real focus of ours as we move into the next 5 or 10 years.
We really need to stay on the cutting edge because doing this job is difficult. But if we can get the equipment to help us along, that will make it that much easier for both us as providers, but for the patient as well.
One of the best things is having family members with tears in their eyes saying, you know, my loved one has never been able to sit in a dental chair for a whole cleaning, and this is the first time they've been able to do that. Thank you so much.
When you get staff, like the staff here at the Tufts Dental Clinic, that care, that understand, that have patience, that are kind, that's all you can ask for.